Good afternoon, and thank you for joining this webinar. This is Amy Vandenbroek. I'm the Executive Director of the National POLST Paradigm and an Associate Director at the Center for Ethics at Oregon Health and Science University. I wanted to thank you all for joining, particularly from the last-minute registration aspect. This will be recorded and available online, and you'll be finding information about this webinar as well as the guidebook that this group created in the June POLST e-newsletter. If you don't currently receive that e-newsletter, please go to www.polst.org and you can sign up at the bottom of our website. Today's presentation, Models for Creating, Developing, and Sustaining State POLST Programs, has been put together by a group of 4 students who are completing their Masters of Science Healthcare Management. This is their capstone project, and they will be graduating shortly on June 5th. Over the last few months, I've had the pleasure of working with Alicia Garrison, Melissa Bierman, Jawanza Hadley, and Kylan Pendleton. And it is my pleasure to introduce Jawanza, who will be guiding you through this presentation.
Thank you, Amy. Hello, everyone. My name is Jawanza Hadley, and I will be your presenter for today's webinar. One moment, please, as I work to get our webinar started from the very beginning slide here. Okay, thank you. And again, my name is Jawanza, and I will be your presenter for today's webinar titled Models for Creating, Developing, and Sustaining State POLST Programs. I am representing a team of graduate students from Oregon Health and Science University. We were tasked with a research project to identify ways that state POLST programs can become sustainable. Our final product will be a resource guide, which will be available soon. The purpose of this webinar is twofold. One, to provide a summary of the research and take a look into the content of the resource guide. And 2, to get some feedback and input from POLST programs around the country. So let's take a look at our agenda for today. We'll have a short introduction. I'll talk about coalition, homes, funding, business plans, and at the conclusion of this webinar, we'll save the last 10 to 15 minutes for questions. Also, I want to remind attendees that if you have a question during the course of this webinar, you can type your email into, your question into the chat window located on the left-hand side of your screen. Also, if you just joined, check your email as we do have an outline that follows along this presentation. And if you need to have access to that, you can type your email into the chat window and we can get that to you. This outline is provided for your convenience should you want to take notes. So again, we welcome you this afternoon and thank you for joining this webinar. Each state POLST program has developed independently, and as a result, there is great variation between programs. After surveys, phone calls, and investigating best methods, we identified 4 key areas POLST programs should consider. These areas are coalition, home, funding, and business plan basics. The first one we'll talk about today is coalition. If you're following along, please refer to the coalition section of your outline. So when POLST programs are creating a coalition, there's a few key reasons they should do, there's a few key purposes for creating a coalition. One, it allows for an organized and formal approach to implementing a POLST program. It helps to ensure key stakeholders are participating in the POLST program development. It coordinates with the national POLST program. It helps to develop educational materials, and it creates and conducts quality assessment activities. The first part of creating a coalition is building a team. Make sure you have the right people at the table. This would include key stakeholders, community leaders, policymakers, and other key organizations. You'll want to consider the number of members in your coalition for manageability. Also, make sure all of the members are qualified and understand the essentials of POLST. Everyone may not be a good fit, even though they have the best intentions. After building your team, you'll want to consider leadership and structure. So as a POLST program looks to build capacity, there's some key things we want to take a look at. The leader or program manager could be appointed to complete the essential tasks. Possess the skill of delegation to help with program administration. Mentoring to help with succession planning. And the leader should be an advocate of POLST, and it would be helpful if the leadership has the ability to recruit other coalition members. After building a team and creating a leadership structure, POLST programs will want to ensure the team stays functioning and well. To do that, we'll take a look at some ideas around how POLST programs can maintain the coalition. One, create a clear organization structure. This includes clarifying roles and what is expected. Formalize structure and practice with documents such as bylaws and written roles for team members. Also employ management strategies such as effective communication, conflict resolution plans, and decision-making guidelines. Organization effectiveness is also related to positive work environment. To do this, create ground rules for how the coalition will function, and also ground rules for meeting etiquette. The second part of maintaining the coalition is creating annual plans for review. This is taking into consideration things such as dates for membership updates, dates when leadership or work teams will change, and POLST programs will want to make sure that plans are clear, concise, and easily accessible. So when we look at creating a coalition, there are some benefits and challenges. For example, networking within your program with the national office and with other community organizations can prove to be a great benefit for your coalition. The challenge that comes with that is the time commitment that will be necessary to make that happen. Another benefit of coalition is the information sharing that takes place amongst members. A challenge with this could be the loss of autonomy as the sharing takes place. So some things to consider, and POLST programs should look into when they're forming their coalition. Have a conflict resolution plan in place. Consider poor management of a coalition can lead to a poor image. Coalitions can create more networking and opportunities. And the maintenance of your coalition will take time, so be sure to delegate as necessary. So here's an example of a resource used to run effective meetings that can help as you create your coalition. This helps with thinking about meetings, determining the structure and purpose, and working to communicate in advance. It's really creating a plan for how you will conduct your meetings that will be necessary as you move through to create your coalitions. So the next section we're going to talk about is home. At this time, if you're following along with the outline, please refer to the home section of your outline. Like many sections that we'll talk about in the resource guide and in this webinar, there is no one right way to decide where your POLST program will be physically located. Many possibilities exist. Current structures for homes for POLST programs include nonprofit entities, academic health centers, insurance companies, physician practice, and state agencies. So here are some benefits and challenges to consider as you look to decide where your POLST program will be physically located. Each program must assess their own needs. For example, if your POLST program has access to funding and it is not of a major concern, maybe a nonprofit would be a good place to be housed. If funding is a concern, it might be more beneficial to form your home with a for-profit organization that has easy access to funds. This table is also located in the resource guide, which you will be receiving shortly. Here are some additional questions to consider as you look to decide where your POLST program will be physically located. Does the potential organization align with the mission of the National POLST Paradigm? Having a home that doesn't support the National POLST Paradigm mission is potentially insurmountable. Is the potential organization willing to be collaborative? The goal of POLST is statewide use. This necessitates working with all key stakeholders. Consider how collaborative this structure will be in some states. The key to a successful home was locating an entity that healthcare systems considered neutral. Does the potential organization support coalition? You want to make sure your home allows you to collaborate and build a coalition with other members of the healthcare community. How is the potential organization going to support your POLST program? So besides a physical location, does your potential home provide you with any other benefits, such as phone services, IT support, staff, etc.? Once 2 or 3 possibilities are identified, complete at least an informal strength, weaknesses, opportunity, and threats analysis, also known as a SWOT analysis. Here's a quick look at what a SWOT analysis looks like. This can also be found in the resource guide. Answering these questions about your organization can help determine what best fits your needs for where your program will be located. So now that we've looked at creating a coalition and building a team, we've looked at where our POLST programs might physically be located. The next thing we want to take a look at is funding. So at this time, please refer to the funding section of your outline. The first thing you'll want to do when considering funding is to create a financial plan. This is really thinking about how we can gather support around resources to fund creating a coalition and where we're going to be physically located. The first suggestion is to create a financial advisory committee. So a financial advisory committee will have some key tasks. Some example of those are identifying financial leadership within the committee. Hopefully this is someone who has some background with finance or has community connections with other individuals who have a financial background. 2, work with the coalition leader to create an annual budget. Decide where the funds will reside. So are you going to use a certain type of bank? Set up processes for acquisition and dispersion of the funds. So once the funding is acquired, how will different team members use and spend those funds? The second part of funding is to create a resource development team. This is different than the Financial Advisory Committee in that this team is solely focused on identifying resources where funding can be found. Here are a couple of examples of some key tasks for the resource development team. 1, set up staff with fundraising experience. 2, prepare general support or project proposals. 3, decide on the fundraising events, the type, when, and where the fundraising will take place. And then decide on a structure of an annual campaign. The next component of funding is creating a budget. We do have an example in our resource guide of some potential expenses for a budget. But here's a few examples. Program administration. This would include things such as staff salaries, rent costs or lease, IT costs such as POLST registry, computers, laptops, website, or other digital related information. Educational materials. This would include things such as pamphlets, brochures, post forms, and maybe who's paying for them. And finally, travel. Attending national or regional POLST conferences, community outreach, or organizational collaboration. So that if the resource development team is instrumental in identifying the resources, what do they look like? Here are a few examples of some of these funding sources. You'll want to consider some questions as we look to gather funds from potential funders. 1, how does the funder operate? Are they annual? Is it multi-year, or is it a one-time funding? 2, what do or don't they fund? For example, operations, education, research, or policy. And 3, have they ever funded a program or a project like this? Here are some specific examples of funding sources. 1 is an organizational partnership. An example of this would be the Oregon POLST program works together closely with Oregon Health and Science University Center for Ethics. It's a mutually beneficial situation. The Oregon POLST program has a great resource through funding and foundations. And OHSU, or the Oregon Health Science University, has a good image. A second example is in-kind donations. Don't forget to include things such as equipment, computers, office furniture, phone, and even volunteer time when approaching potential funders. When looking at foundations, there are 2 different types, private versus public. There's also grants, and something to be considered that's different between foundations and grants. Grants have an equal opportunity. They have detailed written criteria. They typically have a review panel of outside experts. Staff members are generally assigned to answer questions about the grant. And last but not least is individual donor stewardship. Individual donors, rather than having an organization donate, it can be one-time, annual, or for estate planning. One of the things to consider about individual donors is they take a substantial amount of time, but can be helpful for funding a quick project. So grant management. One of the things in our research we found from talking with different programs throughout the country is questions around how to manage grants. So one of the things we want to make sure we point out is that grant makers want a sound return on their social investment, and donors expect results. So it is important to have a money management plan in place once funds are secured. Your POLST program may need an integrated IT system to help manage money. There are several specific programs and software designed to help nonprofits manage grants. Here are a few examples. One is Brommelcamp, and two is Philantech. These are grant and donor management systems that can help you manage the finances and tracking of the money that comes in and goes out and the way it's spent for your grants. If your POLST program has limited or no funds, you can also use other software or programs to help with the management of your money. This would include programs such as FreshBooks, Wave Accounting, Intuit, QuickBooks, and even Microsoft Excel. So now that we've talked about coalition, POLST Home, and funding, we're going to now take a look at the business plan. So this is where we put everything together. To start out, we'll want to take a complete and internal assessment of the business. What is the current state of the POLST program? Knowing where you are at is the starting place for figuring out where you want to go. One of the key things we want to point out is that a business plan for a POLST program may not look like a business plan for a typical nonprofit. So let's take a look and see what that might look like. First, we'll start with the executive summary. This is actually completed last, as it is the summary of the entire business plan. It also can be used it can be easily included in grant applications. Second, we have the POLST program overview. This is where we're taking a look at the mission, vision, and values of the state POLST program and how it connects to the national POLST paradigm. 3, organizational environment. This is taking a look at the landscape of end-of-life care planning. Where is it at currently? Where has it been? And where is it going? POLST program description. This is really focusing in on the operational aspects of your POLST program. So this ties into our coalition. What is the leadership structure? Who reviews the forms? How are they distributed? What are the educational programs for practitioners? How can we make connections to them? This is a general sense, the day-to-day operations and ins and out of the POLST program. POLST program strategy. This is really creating a time frame from program ideation to implementation. We like to think of this as the roadmap to the future. And finally, we have financial assessment and strategy. This is really connecting each piece together through the lens of funding. So what is the strategy and approach we're taking to securing or creating a coalition? What funding is needed for the leaders that we're going to have as part of our program? And then what type of funding do we need to create our physical location? A couple key things to keep in place as we think about our business plan. One, we want to ensure that key players are in place. We also want to make sure that all key outside stakeholders are at the table. And one final thing as one final reminder, not all POLST programs currently have a business plan, but this component is necessary. It's important for success and sustainability and must be updated on a periodic basis. So in conclusion, this is a summary of the research that we've conducted thus far. We do have a resource guide that will be available in 1 to 2 weeks. We work to include as many states as possible. We realize that there may be some states that we didn't talk to. It's also important to note that as we conducted our research, we saw a logical order. So we went from coalition to home to funding to business plan. However, as POLST programs are looking to either create or further develop their own program, you'll want to look to use this information as a resource. One or more topic areas may be applicable. It really is dependent upon the current state of your program. We encourage you to use the information that applies to your program specifically. So this concludes the presentation portion of our webinar. We'll open it up now for questions if you have them typed into the chat box. And thanks again.